Hair transplant is a very emotive subject, particularly for men and some ladies. It has been available for quite some time in mainly two different techniques, and they are FUE, which is a slightly older technique, and FUT, which has been available for the last 10 or 15 years. The full name for FUE is follicular unit extraction, and the FUT is follicular unit transplant. The FUE is where we take the individual hair follicles one by one with a very fine metal punch, and in the FUT process we used to take the full skin with the hair from the back of the head, a thin long strip, and then we used to stitch the area so that we leave a long but a very fine scar in the back of the head. The problem with the FUT is that that scar is visible if the patient ever shaves their head. Although the scar is long, it's usually fine and very rarely may cause other problems like widening of the scar. With the FUE, the clinics often started to advertise that there is invisible scar, not a visible scar, which is not true at all. The fine punch marks that we leave when we do the FUE process does leave a mark, and it is usually visible when the patient shaves their head. What we should explain to the patient is that the scar with the FUE technique, which is the newer technique, is less visible usually, and that way the patient understands exactly what we are doing. The FUE and the FUT scars can both be camouflaged with scalp pigmentation or tattooing. Sometimes we can even plant a fine layer of hair grafts on the scar to reduce its visibility. At the end of the day, it is our responsibility to explain to the patient that whatever we do, there is a certain element of scarring process, and the patient needs to take that into account.